When considering having any type of surgery on your eyes, it's important to ask the right questions.
Yet knowing what to ask can be a challenge, especially when you don't know what to expect. That's why I recently stopped by Vance Thompson Vision in Sioux Falls to talk with Dr. Vance Thompson about the questions we should all be asking before considering LASIK vision correction. Thanks, Dr. Vance Thompson, for having us out here today.
Thank you for having me, Brittany.
What are some of the most important questions I should ask when considering to get LASIK?
Well, I think first of all, you want to find out if you're a good candidate. And that's where a good eye exam, looking at the thickness of your cornea, the front window of the eye, the health of your tear film, the health internally. And oftentimes your doctor, your eye doctor, can do that. And what's nice about that is you get their opinion. They are very knowledgeable about laser vision correction, and they're knowledgeable about you. So knowing about your eyes is helpful. And then after that, looking and researching the center, what quality technology they have. What is quality technology? And that's why we have a 20-point checklist on our website, so people can use that to research quality. And then surgeon experience is very helpful too. So you put that together, a patient with that's a good candidate with quality technology and surgeon experience, and it can be one of the most beneficial things that happens in someone's life.
So when you mention surgeon experience, how important is that factor? What do we need to look for when we're looking at the surgeon that could possibly be doing LASIK on us?
Well, it's nice to have someone who's seen a lot of cases, because you can help the patient understand how their situation is, because some people have a higher chance of maybe needing a fine tune or a little bit more laser in 3 months. Some people should have a different approach to their astigmatism or whatever. So surgeon experience happens both diagnostically in helping you make the decision, but it also helps in delivering the surgery and making sure that all those things that surgeon experience leads to maximizes safety and minimizes risk. And then there's a healing process. And if someone needs some attention healing, that's where surgeon experience can be very helpful, like in any field of medicine.
So that would be the aftercare.
Yes.
So how can the surgeon help assist you if you do need some healing?
Well, a lot of doctors are trained in the aftercare portion. We call it the medical or the healing portion. So oftentimes we have patients that come here from all around the world that will have the surgery in their first visit afterwards with us, and then do all their care back home. And then we have patients that are from this region that have a great relationship with their doctor, and they'll do the pre-exam and the post-operative care with them. And then if they need us for a healing issue, we're right here for them.
So why do you think it's important to have different methods of LASIK?
Well, remember, laser vision correction involves LASIK, where we make a flap on the cornea, the front window of the eye, and laser, and then lay that flap down. But we also do a procedure called PRK, where we do the laser with no flap. And then we do a procedure called SMILE, where we're doing the correction also with no flap. So PRK, LASIK, and SMILE are the 3 respected forms of vision correction, and it's nice to go to a center that can deliver those options for you and help you understand the pluses and minuses of each for your situation.
So does every doctor offer all of these different methods?
Well, there's centers that do LASIK as kind of maybe a lesser part of their business, and then there's centers like ours where laser vision correction is a specialty. And so different centers have different levels of technology, but they're also real good about being open and honest about that. So it just helps to ask questions.
So now you can get LASIK vision correction other places for cheaper. So what do you say to people when they bring that up and they say, well, I can get it here for a lot cheaper?
Well, that's where the research comes in. That's actually the whole reason we did the 20-point checklist, is so patients could do research and ask the right questions. Rather than think they're getting the same thing for less price, We like to talk about this concept of value, and that is you're born with one set of eyes, and you want the safest, most accurate approach. And that's the whole reason the FDA approved advanced technology. And so looking at technology options and asking the right questions so you can make an informed decision versus just thinking you're getting the same thing for less and then having a problem, wondering how you're going to get that fixed, and then wishing post-operatively you had done your research. Do your research before you do anything medically or surgically to yourself.
Is LASIK painful?
Well, you know, going through it, people can feel some pressure. And then after the numbing drops wear off, there can be 3 to 4 hours of light sensitivity and tearing. But then most people are back to work the next day. And so there can be a little bit of pain in that first 4 hours, but that goes away quickly.
Is it true that I will never need glasses after having LASIK surgery?
No, you know, it's the same thing for people. I like to use people born with perfect vision as an example because we have a lens that sits right behind our pupil that is flexible in our younger years. And when we look at a distance, it's flat. When we zoom in, it gets fatter. And we call that process accommodation in our fancy words. But people born with perfect vision in their mid-40s or early 50s start to need reading glasses because this lens won't zoom in. And the same thing with LASIK. It can help get rid of someone's nearsightedness. It can help them get rid of their astigmatism. But eventually their lens is going to get stiff and they're going to need readers. And we have some neat ways to delay readers, but eventually they happen. So the best way to go into this is with the idea of, I'd love to not be dependent on glasses and do the majority of what I do with nothing. But I realize that when I get into my mid-40s or lower 50s, I'm going to need readers.
So can anyone have LASIK?
Not everybody can have it. That's where it takes a good eye exam. There's some health conditions that can affect the healing. And so you want to be open about your health conditions. We ask about medications that you're on. We look at the thickness of the cornea and the health of the eye and help you make a good decision. But not everybody can have it. And that's why it all starts with a good quality consultation.
All right, thank you so much, Dr. Vance Thompson, for joining us here today.
Thank you for having me, Brittany.
If you'd like to speak with any one of the experts at Vance Thompson Vision about whether LASIK vision correction is for you, give them a call in Sioux Falls at 605-361-3937. You can also learn more about their other procedures by visiting VanceThompsonVision.com.